This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, wouldn't you know it, we have a primary coming up on April 26th that will be here before too long. We've got some very important elections, but first, the challenges facing long-term care today. Joining me is Russ McDaid. He's the president and CEO of the Pennsylvania Healthcare Association. Russ, welcome to the program.
Thanks for having me, Terry. It's a pleasure to be here.
It's my pleasure having you here. All right, let's talk about, in general, the condition facing long-term care. There isn't any doubt that at one point a substantial number of people all over the country, but obviously in our state, end up in a long-term care facility. It could be for a substantial period of their life.
It could be.
What are their challenges? Yeah.
Well, first, I'd tell you it's a pleasure to join you and be here with you today. The reason I'm so excited about my new role as the president and CEO of Pennsylvania Healthcare Association is because long-term care is an issue that's going to impact all of us at some point, as you noted. And there is no shortage of challenges facing our residents who reside in our long-term care facilities and those who provide their care. One of the first pieces, Pennsylvania is an old state and we're growing older. Now, no matter how you cut it, we're in the top 4 nationally in the percentage of people age 65 and older, the percentage of people age 85 and older, which is where the long-term care need really begins. And we're going to see both of those populations over the next decade. They're projected to grow significantly. Our 65 and older population is going to grow by over 30% projected in the next decade. And our 85 plus population, the folks who really then begin to need the type of 24/7 skilled care that our members provide, is going to be closing in on 500,000 Pennsylvanians by that time. And it's going to be essential that we get this right.
Yeah, and I think there are 2 elements to that. I mean, one is that we need, as individuals and as family members, to prepare for this, and too often we don't. I mean, we're not immortal. I mean, we all maybe would like to be, as you know. And then there's the challenge that the health care facilities face in terms of getting the people, making sure there's access and there's enough of them and they're in the right locations. This is a pretty complex situation.
It is. And that you mentioned the immortality piece. I mean, this is something nobody plans for. Yeah. I've got 2 high school daughters. We're spending a lot of time right now planning for their future and them heading off to college, what majors they're going to pick, what schools are best. We spend a fraction of the time that any family spends on planning a vacation usually on choosing our long-term care. Yeah. And the same with our workforce. I mean, if we look at the big challenges facing our sector right now, 2 of the biggest, and the first one I think is workforce. We have that growing population of elders, and one of the ironies is we are living longer and staying healthy longer. 60 really is the new 50. People really are having more vibrant lives through their 60s into their 70s and even their 80s. However, we now have many more people who reach 85, 90, 95, even 100 than we've ever had before, and they need care.
Here's what's also fascinating. I mean, I've had family members say, well, I'm going to keep you here, you're going to stay at home, and everybody means it, but we know at some point that just isn't possible, right?
We all mean it, and we all want to stay at home.
Right, sure.
I don't want to have to go to a hospital to have heart surgery if I have if I need a bypass. However, I want a high-quality hospital to be there if I ever do find myself in that place. Yeah. Our nursing facilities are the same way. Nobody wants to need one. However, we know the reality is that over the course of someone's life, they're going to find themselves in need of, likely at some point, even if it's only for a small period of time, the type of 24/7 skilled care that our nursing facilities provide and that Medicaid pays for here in the state.
I almost hate to mention the word budget, given what the state has just been through. Stopgap budget, we still don't have, quote, a final budget. I guess it may be the final budget. The governor's going to give his message. We're all awaiting that. Well, I have to ask you the big question. How did you fare in the battle that went on for 7 months before the stopgap was approved?
Yeah, it is funny. Most of us who've been around this for a while, budget season has taken on a whole new meaning this year.
Right, absolutely.
Actually, we fared we fared well, all things being considered. And, you know, the first piece is, you know, our nursing facilities who are providing quality care to Medicaid individuals, to low-income individuals, have been being paid throughout the impasse as a result of some court rulings under prior years when we had a budget impasse, so that essential services are still paid for.
Right.
So those folks are still getting the care, and the people who provide the care are being paid for. We have flat funding in the governor's budget, but we didn't see a blue line, and that means that funding is going to flow.
Nothing remains flat, however.
Well, that's correct. That's correct. That's correct. And that's one of the challenges, you know, we see, you know, moving forward is, you know, how can we make those incremental additional investments in our low-income and elderly and people living with disabilities, living in our nursing facilities, so that they can receive the quality care that they deserve.
Now, give me an inkling of what is in the budget that I mean, obviously many of your people are on Medicaid, I would presume. Not every, right, in the facilities. I guess they start out on Medicare for 90 days, and then they would go to Medicaid if they're Medicaid. Now does that state or federal? I mean, that's the federal regulation, but
yeah, it's actually, I mean, Terry, you need to take a course in this just to be able to figure it out. And when it happens, families learn very quickly how complicated it is. The first 20 days in a facility, Medicare pays full freight.
Medicare.
Yeah. Right.
Okay.
Then day 21 to 100, Medicare pays partial freight, with the individual having to pick up the balance.
I'm already confused.
Yeah, that's right. And then day 101 on, you pay your own. Cash.
But look, you're doing you're giving an important lesson here for the viewers out there. Many, you know, parents looking at, you know, or the kids looking at, well, what are we doing with the parents, and some folks with the grandparents. No, this is important, I think. All right, so what are you looking for in the budget?
We'd love to see an increase. Obviously, I mean, that sounds overly simplistic, but it's the reality. I mean, any increase is desperately needed by our nursing facilities. I know you've heard us say in the past when we've been here with you that their reimbursement from Medicaid falls far short of covering their cost of care.
Right.
It's around $23 a day short of covering the real cost of care so far. We expect to see that number go up again this year, so it's a real challenge. So any additional funding in the budget for nursing facilities, and we spend a lot of time in Harrisburg debating whether somebody ought to be served in their home or in a facility, when we really got to get past that and look at funding both. We need to work to open all doors, so when a family has a long-term care need, that all options are available to Pennsylvanians who need the state support.
Let's talk, before I let you go, let's talk a little bit about the quality of care in nursing homes. The state has a responsibility here. Talk about that a bit.
Yeah. Well, the state's involved in the quality of care very directly. The State Department of Health licenses our nursing homes. It's a very rigorous and thorough process. Inspectors come in at least once a year on unannounced inspections and check our operations out, make sure that we're meeting all the regulations, make sure that residents are getting the care that they deserve. So that's a very thorough, process as it relates to quality. We're also continually looking at our own operations beyond the survey and saying, how are we doing in improving the health of the people we care for? And we track that over months and over years and say, are we doing better over the course of time, or are we falling behind? And then we address the issues where an individual facility might be falling behind, because our residents and the staff who provide their care deserve the very best, and we ought to be looking at that on an ongoing basis.
Well, look, I want to thank you for coming in. You'll come back and give us some periodic updates